Good morning. This is Dr. Beck here at LifePoint Medical, and it is Monday, July the 14th of 2025. So I want to say good Monday to everybody, and we're open and we're ready to see you if you need to. We've been busy this morning, but we're not too busy. If you need something, I will just remind you about our work-in slot that we do every day to make sure people that call us can be seen promptly. And I really encourage people to use this as a tactic to keep themselves out of the hospital and things like that. We can't always do that, okay, because emergencies pop up pretty fast sometimes. But we do try to mediate or at least make it as accommodating as possible. So I want to talk to you about a couple things real quick. The first one, I had a patient who came to see me last week. And I had been taking care of him for a while, but he expressed to me that he had got angry with me over something I had said to him. And I got to really thinking about that because he really was mad. Now, I don't know whether he withheld care or not because of his anger towards me, but I think I said something to make him mad. So I just want to address that really because there's a deep conviction that I have about being honest with my patients. And I do this even if it means that our relationship could be damaged by that. In other words, it's more important for me to be honest with people than it is my own business and things like that. In other words, sometimes I say stuff to people and they don't come back or whatever, but I understand they're mad at me. But I have a deep-seated dedication to being honest with my patients at whatever price that is. Now, that doesn't mean I need to be cruel or insensitive, but it does mean that if I feel like something's important for me to say to you, from a medical standpoint, I've got to say it. And I really don't want to apologize for that because it's really important. I mean, you don't want to go to a doctor or a lawyer or anything like that who only thing they're telling you is what you want to hear, okay? Because from my perspective, that's not what you're paying for. You're not paying me to tell you what you want to hear. You're paying me or you're contracting with me to tell you the truth, and that's what I'm going to do. So if you get mad at me from what I'm saying, we can talk about it, but I promise you I'm just have your best interest in mind, and I'm saying what I think is necessary, and sometimes it's not pretty, but I am dedicated to being honest with you. Plus, when it comes to honesty too, and I will say this, over the last 20 years, it's a rare occasion, but occasionally somebody will say that I was dishonest with them. And I will tell you, lying is a logistical nightmare for me. I don't know how to do it because you have to keep up with these lies and stuff like that. So I'm always straightforward and as honest as I can when it comes to doctoring and you and everything else, because I can't keep up with anything else. I have to just keep up with the truth and everything else. So I'm going to try to be honest with you as much as humanly possible. And B, if I say something that upsets you, it's a negotiation. We can talk about it. I'm just here to coach you and help you through whatever situation you're in and give you advice or medical treatment or whatever. But that's my role. My role is not to dictate. It's not to tell you what to do. There's a few occasions when I will tell you what to do, but that's just because I'm a mandatory reporter, and those are certain situations, but those are extremely rare too from my standpoint. But on a day-to-day basis, my job is to be there for you, listen to you, give you my best advice that I can based on what you've told me and the knowledge that I have over the years. So thank you in advance for listening to me on that issue, and I will be honest with you, I really will. And sometimes it hurts me even, but that's what I'm here for. So the next thing I want to talk about is hearing loss. I want to talk about two specific things. Number one, age-related hearing loss is a real thing, and it happens, and it usually starts around the age of 60s in the higher tone voices are the first ones that start to disappear. Now, I spent a few years reading audiograms back years ago, so I could see very clearly the age-related hearing loss that people have. And the answer to the hearing loss is you should be screened for it if you're getting in that range. A lot of times you're not the one that can tell whether you're experiencing hearing loss or not, but the people around you definitely know whether you're not, or whether you're hearing it or having hearing issues or not. And if I walk into your house and I listen to the level, your sound level on your TV, I can tell whether you've got hearing issues or not. So the main thing is hearing loss does affect your social and your mental and physical life if you've experienced it. It can and it will do that. I think it accelerates cognitive dysfunction or dementia that we have to deal with if you've got hearing loss and you're not treating it appropriately, because you immediately stop using significant parts of your brain. So hearing loss is important. You can talk to us about it if you think you've got it, and we'll get you screened and get you taken care of. The last part I want to talk about this, and this is my staff said, would you please let everybody know that if they wear hearing aids, that they should absolutely wear them to their appointment. In other words, lots of people show up here to my appointment who have significantly impaired hearing and do not bring their hearing aids. And it is rough when that happens, because a lot of times I have to yell to get a point what I'm trying to say, and every single person in the office can hear everything that I yell. So please remember, if you wear hearing aids, we're communicating with you very specifically, and this is an absolute time when you would want to wear your hearing aids, when you're at the doctor's office. And if it's that difficult for you, always bring a proxy, somebody else who can help you listen and learn what's going on, okay? But this isn't the time. Your office visit with me is not the time to leave your hearing aids at home. So thank you in advance for wearing your hearing aids for your appointment, so we can talk to you in a normal voice and get across what we need to. Thank you so much for listening to me. It's been good talking to you today. Please let me know and let me help you as much as I can. Thank you so much. Have a great day.